Hey, this is Dr. Firnhaber, and today is Wednesday. It's time for 10 minutes of truth. So, I'm going to review an article that came out this year, 2023. It's out of the Journal of Chiropractic Medicine, which is in the Index Medicus in PubMed. You can find this article. The article is called, I'm just going to shorten the title a little bit because there's a long title. Association between chiropractic, physical therapy, and subsequent opioid use. And what this article is trying to do is to find out if people went to a chiropractor first or a physical therapist first, what their short-term and long-term opioid use would be. Very interesting to think about that. Now, this article involved 41,000 patients with lower back pain without any prior opioid use. And the study was done in Arkansas. Now, one of the interesting things about Arkansas is they have fewer physical therapists and fewer chiropractors per population than just about any other state. And chiropractic and physical therapy is not utilized as much in Arkansas as it is in other states. So let's look at some of the results of this study. So first of all, 50 million U.S. adults report chronic pain on a regular basis. That's a lot of people. Low back pain is the most common non-cancer complaint for which opioids are prescribed. Existing studies show chiropractic care lowers the use of opioids. So this is not the first study done like this. There's been multiple studies done, and this article actually reviewed some of those studies. 1/4 to 1/2 of all patients consulting a primary care provider receive an opioid prescription when they go for lower back pain. 1/4 to 1/2. And you wonder, why is there an opioid epidemic? Another study reported that more than 80% of patients with chronic pain stated that they derived benefit from chiropractic care. So we know, and we have study after study, and next week I'm going to do another one on the lower back pain and chiropractor versus hospital care. But we know that chiropractic care helps patients with lower back pain. Now, patients with lower back pain consult both physical therapists and chiropractors. And I'll say right now, I have no issues with physical therapists. I like a lot of them I met. I think there's some real benefits to physical therapy. It's not at all the same as chiropractic, not even close. But I like what they do. I like a lot of things they do, and there's benefit to it. So here's the odds ratio for opioid use for lower back pain, chiropractic versus physical therapy. So this is for any opioid use. If they consulted a chiropractor first, their opioid use odds ratio went down 12% if they consulted a chiropractor first. If they consulted a physical therapist first, their odds ratio of using an opioid actually increased by 7%. If you look at long-term opioid use, if they consulted a chiropractor first, it decreased by 44%. So we're getting close, not quite, but close to the 50% mark. If they contacted or engaged in physical therapy first, their long-term opioid use increased 19%. So we see here that physical therapy is not that effective. It's not effective at all, in fact, for decreasing opioid use. But chiropractic, as we look, is effective, and for long-term opioid use, it's very effective. So when you consider the amount of deaths, the amount of overdoses, the enormous cost to our culture with people taking opioids, it's a very good decision to consult a chiropractor first if you have lower back pain, rather than seeing a primary health care provider or a physical therapist, based on this study here. So this is just another study which validates the value and the effectiveness of chiropractic care in our culture. And I would say to all of you out there, most of you know people that suffer from lower back pain. So call our office, bring them in. Let us do at least a preventative health screening on them and see if we can help them. Because the chances are we can. And if at all possible, and if it could happen, we'd like to keep them from taking opioid drugs. So that's all for this week. Next week, we'll be back with another 10 minutes of truth. We'll see you then.